Obstetric fistula is a terrible injury. It happens during childbirth when a woman endures a long, obstructed labor, and she has no access to timely medical help. A hole forms between the birth canal and the bladder, or sometimes the rectum. It is a hidden injury, but its effects are not hidden. It steals a woman's dignity and her health. This is a preventable tragedy. The consequences for women are truly dreadful. They suffer from constant leaking of urine or feces. This leads to painful skin infections. Often kidney disease follows. Many women become infertile. The smell can be overwhelming. It is a daily reminder of their suffering. Their bodies are broken by a natural process, a process that should bring joy, not despair. The pain is not just physical. Beyond the physical agony, there is deep emotional trauma. Women with fistula are often shunned. Their communities misunderstand their condition. They are seen as cursed or unclean. Husbands may abandon them. Friends and family might turn away. They face profound social isolation. Unable to work, they fall deeper into poverty. Their dreams for the future crumble. They live in shame and silence. This condition is more than a medical problem. It is a stark symbol of inequality. It shows failures in our healthcare systems. It highlights gender disparity. Poverty plays a huge role. Early marriage and malnutrition make girls vulnerable. Lack of education is also a factor. When a woman cannot get quality maternal care, fistula can occur. It mainly affects the poorest, most marginalized women and girls. They are the forgotten ones in many societies. The world needs to know about obstetric fistula. It is observed every year on May 23rd. The United Nations launched this important day in 2013. It was a call to action, a recognition that these women deserve better. Their silent suffering needed a global voice. We must raise awareness about this horrific condition. It is about dignity and human rights. Every woman deserves a safe passage to motherhood. The theme for 2025 offers a clear path: breaking the cycle, prevent, treat, restore. This theme guides our actions. Prevention is the first crucial step. This means skilled birth attendants at every delivery. It means access to family planning services and timely emergency care, like cesarean sections. Treatment is the second part of the cycle. This involves providing accessible, affordable surgical repair. For women who already suffer, surgery offers hope. Then comes restoration, a vital element. It is not enough to just repair the physical injury. We must restore a woman's dignity. We must help her reintegrate into her community. This includes psychosocial counseling and economic empowerment programs so she can rebuild her life. Many organizations are working tirelessly on these fronts. They are bringing hope to countless women. Their efforts are changing lives, one woman at a time. The United Nations Population Fund, UNFPA, leads a global campaign. The campaign to end fistula started in 2003. It operates in over 50 countries. UNFPA provides free surgical repairs. They offer counseling and support for survivors. They train healthcare workers to prevent and treat fistula. Tens of thousands of women have received life-changing treatment. Other organizations like FIGO are also key players. FIGO's Fistula Training Initiative, for example, builds surgical capacity. They achieved 20,000 fistula repairs in 2023 alone. New initiatives bring fresh hope. Just yesterday, on May 22, 2025, the Musa Project launched in Uganda. Led by Associate Professor Musa Kayondo, it aims to perform 2,000 surgeries annually. It will develop new women's health wards and implement training to reduce new cases. This shows the ongoing commitment, but progress is fragile, especially in conflict zones. Partnerships between governments, NGOs, and communities are essential. We need more such dedicated efforts. The most important truth about obstetric fistula is this: it is almost entirely preventable. This is not a disease without a cure. It is an injury that results from a lack of care. Quality maternal health care is the key. Skilled birth attendants can make all the difference. Timely medical interventions save lives. This includes access to cesarean sections when needed. Family planning services also play a vital role. Delaying marriage and childbirth for young girls helps. Ensuring good nutrition is also important. We must champion women's health rights. Every woman has the right to a safe childbirth. She has the right to health and dignity. These are not privileges. They are fundamental human rights. When a woman suffers from fistula, her rights have been violated. We must ensure that healthcare systems are strong. They must be accessible to all women, regardless of where they live or how poor they are. This requires political will and investment. It is a matter of justice. Governments have a critical role to play. They must invest more in maternal health care, especially in rural and underserved areas. They must strengthen health systems, train and retain skilled healthcare workers, empower women and girls through education, and challenge harmful social norms. Civil society organizations are also crucial. They raise awareness and provide services. They advocate for the rights of women. Individuals too can make a difference. We can all help break the cycle of fistula, support campaigns and organizations working on the ground. If you can, donate to their vital work. Raise your voice and spread awareness. Use social media to share information. Advocate for universal maternal health coverage. Amplify the voices of survivors. Let their stories inspire action. Together we can end obstetric fistula. Let us make this preventable condition a thing of the past.